Hello, Teresa. Good to see you again. I'm keen to see those low-friction catheters you were talking about. I've got a few patients at the moment who could use them.
Hi, Libby. Good to see you too. It's been a few months, hasn't it? Yeah, look, these are great.
They seem to be. Tell me a little about them.
Right, well, the reason we've developed these self-lubricating catheters is because the low-friction aspect makes them more convenient and safer.
Okay, sounds good. My patients always have to carry tubes of lubricant with them, which is quite inconvenient. Having to put on lubricant is also difficult for those patients who don't have manual dexterity, because of other conditions they may have.
Yes. These catheters have a number of advantages, but I'd like to focus on the surface of the catheter.
So, the surface is different?
Yeah, it's coated with a special layer that makes catheterization more comfortable.
More comfortable?
Yes, we've coated the catheter with a hydrophilic surface, which means that the catheter has low friction when inserted.
That's great. It would mean less trauma to the tissue around the urethra.
Yes, and that's important when you think that a person will catheterize herself or himself quite a few times a day.
Yes, that's right. What about reusing the catheters?
Unfortunately, these catheters can't be reused. The outer layer loses its lubricating ability and there is also a greater risk of infection.
I suppose that's where the older catheters have an advantage. Even though it's inconvenient to carry around a container with disinfectant, the catheters can be reused, so that cuts down the cost a lot.
Yeah, you're right. But even though the older catheters can be reused, if they aren't sterilized properly, the risk of urinary tract infections is quite high.